Hello everyone, welcome back to my channel. Time with Nurse Joycelyn. Today let's discuss a topic that is often misunderstood: uterine fibroids. What are they? What causes uterine fibroids and what are the treatment options? Stay tuned. Uterine fibroids or leiomyomas are growths that are made of muscle and tissue and can form in or on the wall of the uterus. They are usually non-cancerous and medically we call them benign tumors. A person has no symptoms sometimes, and they are even unaware they have fibroids. They can cause a variety of symptoms such as pain and irregular menstrual bleeding. Fibroids can grow as a single nodule, that is one growth, or in a cluster. Clusters of fibroids can range in size from 1 millimeter to more than 20 centimeters in diameter or even larger. For comparison, we can say that they can grow as small as a seed or as large as a watermelon. This growth can occur within the wall of the uterus, inside the main cavity of the uterus, or on the outer surface of the uterus. There are different types of fibroids depending on where they grow and where they attach. Specific types of uterine fibroids include intramural fibroids. These are embedded into the muscular wall of the uterus and are the most common type. Submucosal fibroids are the type that grow under the inner lining of the uterus. Subserosal fibroids grow under the lining of the outer surface of the uterus. They can become quite large and grow into the pelvis. Pedunculated fibroids are the least common types. These fibroids attach to the uterus with a stalk or a stem. They are often referred to as mushroom-like because they have a stalk and have a wider top. Most small fibroids don't cause symptoms and don't require any treatment other than a regular observation by a healthcare provider. However, larger fibroids can cause a variety of symptoms such as excessive or painful bleeding during menstruation. Other symptoms from larger fibroids may include bleeding between periods, feeling of fullness in the abdomen or bloating, frequent urination that results from the fibroid putting pressure on the bladder, pain during sex, low back pain, constipation, or increased abdominal distension, making the abdomen look pregnant. These symptoms may stabilize or go away after menopause because hormone levels decline within the body. Now, you may wonder what causes fibroids. The cause of fibroids is actually unknown, but experts believe that the hormones estrogen and progesterone play a role. Studies show that fibroids grow when hormone levels are high and shrink when levels are low. There are several risk factors that play a role in your chances of developing fibroids. These may include obesity and a higher body mass index, family history of fibroids, not having children, early onset of menstruation, and late age for menopause. Most fibroids don't cause complications, but the most common complications may include excessive bleeding, pain that becomes unmanageable, swelling of the abdomen or the pelvic area, anemia resulting from heavy bleeding, and then infertility that is rare. How do we diagnose fibroids? In most cases, healthcare providers or doctors discover uterine fibroids during a pelvic exam. Quite often, heavy bleeding and other related symptoms may alert the doctor to consider fibroids as part of the diagnosis. There are also several tests that can be done to confirm fibroids and determine their size and location. These tests may include ultrasonography, magnetic resonance imaging or MRI, computed tomography or CT scan, and laparoscopy. Treatment for fibroids can vary depending on the size, the location, the number of fibroids, as well as the symptoms they are causing. If you are not experiencing any symptoms for fibroids, you may not need treatment because small fibroids can often be left alone. Treatment options may include pain medications to help manage the pain and discomfort, iron supplement if you have anemia due to heavy bleeding, and then fibroid surgery. You can also be given gonadotropin-releasing hormone agonists. These medications work by shrinking fibroids. They are sometimes used to shrink fibroids before surgery, making it easier for the fibroids to be removed. These medications are, however, temporary, and if you stop taking them, the fibroids can grow back. Can we prevent fibroids? No. In general, we can't prevent fibroids. However, you can reduce your risk for getting it by maintaining a healthy body weight, having a regular pelvic exam, and if you have small fibroids, you develop a plan with your doctor to monitor them. Now let's discuss certain myths and facts about fibroids. Some people think that fibroids are cancerous, and whenever they are diagnosed with fibroids, it means they have cancer. The truth or the fact or the reality is that fibroids are not cancerous. They are actually benign tumors. Others also believe that fibroids can only affect older women. The truth is that while fibroids can affect women who are in their 30s and 40s, they can also affect women of all ages. You really don't have to panic when you have fibroids. You rather have to seek medical intervention from your healthcare provider or your doctor to prevent further complications. And please remember, if you have fibroids, it doesn't mean you have cancer. Fibroids are benign tumors and not cancerous. Thank you all for watching once again. If you have any questions or comments, kindly leave them in the comment section for me below. And then don't forget to subscribe and hit the notification bell to stay updated on future videos.